All right, this is episode 973. Not really, I'm kidding. I don't know what episode this is of Boost Bariatrics podcast, but today I'm with Mike Grant. Mike is the CEO of the Surgery Center of Amarillo here in the Texas Panhandle, and Mike has a wealth of experience in the bariatric space and repping bariatric products, being in the OR with bariatric surgeons, and now running an ambulatory surgery center for, I'd say, one of the busiest bariatric clinics in the country, certainly, and probably one of the biggest cash pay clinics. So I thought this would be a great interview. Mike, thanks for joining.
Absolutely. Well, Maddie, thanks for having me, and hopefully this interview isn't the 973rd worst of your 973 podcast so far, and hopefully it's just something that someone can pick up a nugget or two that helps them. Love to share and help out, and it's been a fun journey as we've started this journey with getting the surgery center off the ground and going, and now through accreditation and all the commercial insurances. So it's been a good process, and love to talk to you.
Yeah. Don't tank my audience here.
Okay.
I've got at least a dozen people that tune in every week here.
Okay. There we go.
Kidding. This is I'm actually sitting in Mike's office, so this is a rare one. Usually it's via Zoom. Okay, so let's start off real quick. Can you give a 1 or 2 minute snapshot of your career in bariatrics before you got into the ASC world?
Okay. Well, I'll kind of start you before. So, went to the military straight out of college. So went to a military academy, was an officer in the Army. Always thought I would see myself in kind of an operational or kind of a leadership role being in the military, because going to a military academy, that's kind of your background. Was getting out of the Army, didn't know what I wanted to do for sure. Interviewed with a few different companies. And a friend of mine that was a year before me at West Point was a rep for Ethicon, which is a J&J, Johnson & Johnson company.
Yep.
And he loved the operating room, loved operating, being around physicians, nurses, clinical staff. And he's like, dude, I love working for Ethicon. It's a great company. And he's like, we do a ton with bariatric surgeons, all this stuff. So I actually shadowed a guy in Denver, Colorado, who was the former Army officer that got out of the military, went to work for Ethicon, or at the time it was Ethicon Endo Surgery, and then it just became Ethicon. But so went to work for Ethicon, and so I went and shadowed this guy for a couple days. I was like, man, this is pretty cool. We were in surgery, you were helping, talk to the doctors about all this advanced technology products, and I was like, this kind of fell in love with them, like the operating room, cool environment.
Mm-hmm.
And then I loved bariatrics because we're literally like you're changing someone's life, so a lot of times with surgery, someone has a surgery because of broken finger. Okay, you got to go get your finger broken, or you tore your ACL. It's something traumatic happened, and then it's getting fixed. Or you have appendicitis, you get your appendix taken out. One thing that when I talked to those bariatric surgeons that day, they're like, hey, we are helping provide a tool and a resource for these people to change their lives. And I could see the passion from the patients to the physicians to all the people in the room. It was like just this passion of, helping these people with something that was more than just like, hey, you tore something and you fixed. And nothing against anything like that. Those are great specialties. We do a lot of, elective surgeries here and trauma surgeries here and things like that. But I could see that's kind of what spurred me into actually liking Ethicon was bariatrics in itself. So went to work for Ethicon, was at Ethicon for 7 years, was kind of in the leadership development track with Johnson & Johnson and Ethicon. Didn't know where, the career would go, if that meant into getting up in, different levels of sales management with Ethicon. But I worked closely with, the doctors here in Amarillo, Dr. Sneeder John, Dr. Nikoy, and then even Dr. Peterson before he joined, their practice and was at Texas Tech. Worked really closely with him and, kind of looked at what do I want to do long term. The family here kind of wanted to stay in Amarillo, and the doctors kind of approached me, the physicians approached me about, hey, we really want to open up an outpatient surgery center. You understand not only operations from your time in the military, leadership time, with managing people, but also managing supplies, since you work for Ethicon and understand the vendor side of the world and the supply side of the world. And from everything that they've read, managing kind of your supply cost in the outpatient surgery center setting is kind of key to, your sustainability. So they said, hey, do you want to open up this ambulatory surgery center and we're going to focus on bariatrics? And I was like, sounds fun. So we started and we did our first case in November 1st of 2017. And I think we're getting close to doing over 1,000 just weight loss surgery procedures now.
Yeah.
I think we actually will get there in this next month in August. We should hit our 1,000th case for just bariatrics. So, but it's been a fun journey and learned a lot along the way.
Sure. And yeah, I remember I was at the walkthrough here when they were building before it was actually open. And then just to give some context, and feel free, tell me at any point if you say that's none of your business, I don't want to share it. Yeah. But the guys went out and recruited a few other partners in other specialties to put in this ASC. This ASC is in the medical district. It's got how many ORs?
2. So we have 2 operating rooms. Yep.
2 ORs with the capacity to expand to a couple more, right?
A couple more. We have the footprint and the space to add on a couple more ORs if we ever need to. Yeah.
So they sold some equity to other physicians to start up. Pretty competitive here. There's 2 other. What do you call them? They're not.
Surgical hospitals.
2 surgical hospitals, 2 major hospitals where we could hit all of those with a rock almost from here. And so got rolling, and then I have a very outside view, but there were some pretty big hurdles with insurance, right? That took. Can you just give an idea how much longer? From everyone thought we'll start day 1 and we'll be on insurance plans, and how long actually was it?
Yeah. So interesting. When you go and you talk to other facilities that kind of went through this, or you talk to a consulting company that helps get, surgery centers off the ground and taken off. Everyone presents a timeline, and a lot of times that timeline's not even close to what reality is. So I wanted to touch on one thing you mentioned too. Originally, the bariatric surgeons were just going to have this facility was going to be their office, and then they were going to have their office here, and then just do a way to really reduce the cash pay price from the hospitals, because the cash pay price for the hospitals was a pretty significant number, and they wanted to really lower that cost of healthcare and lower the cost of bariatric surgery here. And they were originally going to move the office down here, and then one day a week we were going to do just the cash pay surgeries in the OR. And as they looked at buying the building and kind of turning this into a surgery center, there was a ton of other physicians in town that were like, man, we need an outpatient same day surgery center in town, because there are some surgery centers in town, but they're all surgical hospitals, so they bill the hospital outpatient rate. So I think there was a need in town for like a true day surgery center that would help lower healthcare costs. People can go home the same day, and it just was an opportunity that a lot of other physicians were like, hey, we want to be a part of this. So we originally started with bariatrics, and then we added a general surgeon, a couple podiatrists, a neurosurgeon, so neuro and spine. And then now I think today there's overall 11 physician owners that, are owners in the facility.
Yep.
And we have 14 physicians that operate here regularly and 20 to 25 physicians that are credentialed. And we do everything from bariatric surgery, general surgery, neuro and spine, orthopedic, to include like total joint, sports management. We do cardiac cases here now.
Yep.
So it's really kind of expanded.
Yep.
And now, it's 2 operating rooms, and we do close to 200 cases, pretty much 200 cases every month.
Yep.
So pretty busy, for the 2 operating rooms.
Just let me jump in, because I lost track of the numbers. How many admin staff on this side and clinical staff over there?
Yeah, so we have 5 people, I'd say, are in the business office side of the surgery center, and then 17 people on the clinical side, from instrument processing to materials to recovery, pre-op, and then operating new nurses and surgical techs as well.
Okay.
So 22 people overall in the facility.
Okay.
And then we have some part-time staff to help out, a couple days a week here and there on their busier days. But yeah.
Yep. What would you tell someone? We have another. There's another bariatric clinic who's actually in the process of putting together an ASC. What if someone said, "What advice do you have?"
Yeah.
What would you say?
I would say, one, pick good staff. Pick the staff that, so have good people, surround yourself with good people. 2, set realistic expectations, or it's going to take you a lot longer. And I failed to mention what you asked me earlier was the timeline and all that, which I'll get into here in a second. But the timeline for getting on your Medicare license, getting on commercial insurances, is substantially longer than they'll tell you. Everything takes longer, and then you re-sign something, you have to re-sign it again. That kicks contracts back 30, 60 days. I'll just say be patient and remember, put your patients first. Always do the right thing, then eventually it'll work out. But hire good people, and then just every day try making progress. But with us, so we opened in November of 2017. We thought it would take 12 months. We'd get our Medicare license. We would get on all the commercial insurances and then go from there. And then we even thought, do we not do a Medicare license? Do we not get accredited? Stay out of network and just bill insurance as well. I think healthcare has changed a lot to where, where you used to be able to bill insurances out of network and all the things, that insurances have gotten smarter. And a lot of times patients on their insurance plans don't even have out of network benefits. So it's meaning it'd be all patient responsibility. So when we analyzed that, we didn't think it'd be the right thing to, bill an insurance if insurance doesn't pay it, then have to send patients, large balances and things like that. So we chose to go down the accreditation and Medicare route. And so we did our first case November 1st. Our accreditation, we used a accrediting company, AAAHC, and they came and did our Medicare Deem survey. That was in March of 2018. And then,
I didn't get that.
Sorry, that was my watch. I must have bumped the button on my watch there. But so we got our Medicare license March of 18. Then you have to turn in, anything that they find, you have to write your things back. So we ended up getting our Medicare license in April. And then we thought, okay, 30, 60 days, you'll get on all the commercial insurances. Well, that's the process that I think took a lot longer, because you have to then get credentialed with the commercial insurances. So you're Blue Cross, United, Cigna, Aetna, Humana, First Care, or Baylor, Scott & White's another pretty big insurance here in Texas. And that process really, we are just now getting Aetna August 15th of this year, so of 2021. So 3.5 years later, Cigna we got pretty quick, Humana we got pretty quick. Aetna was the first insurance company that we actually were credentialed with, but then just negotiating your rates, the insurance saying, hey, we want another ASC or ambulatory surgery center in your network or in your market area. So all that kind of took a lot longer as well. And then one thing I think that we underestimated is, you make some traction with, your Blue Cross, United, Cigna, Aetna's, and then you're working with a lady. She understands what specialties you're doing here, kind of what your goals are, what their goals are, and then that person moves on.
Right.
And then another person's in there. Well, that takes you 3 to 6 months.
Oh, yeah.
So I think and I'll give Blue Cross Blue Shield as an example. In August of 18, we thought we were almost finalized with the Blue Cross Blue Shield contract. We did not get our finalized Blue Cross Blue Shield contract until July, or actually August of 2019, because we had some management personnel transitions in Blue Cross Blue Shield, and then we got sent the wrong contract and had to re-sign it, and then got sent the wrong one. Then the insurance loaded the incorrect contract, then they had to deload that from their payment system. So just that whole process, took a lot longer than we thought.
Sure.
So very trialing, but you have to just be patient, stay the course.
Yeah.
And no one's trying to make things, I think that's the key thing that I learned is, no one's trying to make things take longer. It just does. So just be persistent, just stay, kind, nice, and just follow up with them, and it'll happen when it's supposed to happen.
Oh, and be financially prepared to weather that.
Yes, yeah, and thank goodness for us. So I would say any facility trying to kind of open up, we did have that cash bariatric business.
Right.
So since roughly 30 to 40% of insurance plans don't cover weight loss surgery, so we had the self-pay or cash bariatric business to help keep us going and afloat. Because if you were doing this and all you were waiting on was insurance contracts, and you didn't have that base of business from self-pay or cash procedures, it would be hard. You'd have to have a lot of capital money built up to help get you through, that timeline and weather that storm.
Yeah.
So that's kind of really what helped keep us afloat until we got going, So.
Absolutely. Yeah. And, when I'm up here, it's kind of like you're running a big restaurant, because, in a restaurant, the two main things are the cost of food and having too much employees or too little.
Yeah.
And it seemed like, the biggest growing pain for you guys was managing all the materials for all the different specialties, making sure you stay on top of your costs with those, and also, as you're growing, managing staff, because it's like every day it changes from, oh my gosh, we're way overstaffed, this expense is killing us, to we're way understaffed, we gotta ramp up.
Yeah.
Is that?
Well, I think it's kind of, you're kind of fine now. We've kind of gotten that sweet spot, and we understand how many people per day.
Yes.
But as we've added on specialties, physicians, insurance contracts, there's some days we'd have weeks where we'd have 14 cases on Thursday, and you're running around like crazy, and it's super busy. And then Monday there'd be like 3.
Yes.
So now it's kind of leveled off every day, and we've kind of adjusted physician block times, looked at who's using the OR, and how do you get to a consistent level where every day you have the ORs are being utilized. But there for a while we'd be here from 7 till 7 on Thursday, and then 2 cases on Monday.
Right.
But that's kind of leveled out now, and it's hard to staff that when you have a few days a week where you're not doing anything, a few days a week where we're a lot busier.
Yeah.
And then, and it's inconsistent. So you can't really offer someone a full-time job if you don't have that consistent case volume. So the staffing was kind of challenging. What we started, we were just doing 1 day a week. So we're just doing Thursdays. And then we were like, okay, we want to add another day. Well, it made sense to add it just on Wednesday. So when we got our Medicare license, we just did cash on Thursday, Medicare on Wednesday. And it was easy to staff because it was just 2 days a week, and we'd find part-time people to work Wednesday, Thursday.
Right.
Well, then we added on Tuesday. Well, then we added on Monday, and then we added on Friday. So it's kind of grown, and then it was Friday just one room, and then it went Friday to both room staff. So it kind of just grew as we kind of grew and got more surgeons coming over and operating here. But with us, doing so many different surgical specialties, my kind of background, I was used to the laparoscopic equipment, bariatric equipment, and really understood the supplies in that space, in that kind of market area. And then as we added orthopedics, neuro, and spine, a lot of those procedures are very heavy implant costs. And us being the only ambulatory surgery center, there are surgical hospitals. Well, a hospital gets paid for the exact same procedure we do. Hospitals getting reimbursed sometimes double what we are. So we have to be very cost conscious, and I think that's a change for kind of the supply and vending world, because they're used to, in this area, dealing with the hospitals. And something where they're used to a implant costing, let's say, $20,000, and the hospital's making 30 on the case. That's a great case. Well, when we're making 17 on a case and the implant's 20,000, that's not going to work. So we kind of had to really go to those companies and say, hey, like, we really need to help partner with us. And we can't make some of the the prices you're used to selling to hospitals work, and it's just been a huge learning curve as we've added on all these different specialties. But I would say that definitely the supply costs, I mean, that's you're gonna make or break a place based on kind of what you use. Staffing is important, and then supply costs is even more so.
Well, I think from your first case until now, you are the only true ASC in the area within, I don't know how many miles.
Well, yeah, so there's other ambulatory surgery centers in Amarillo, but they're all single specialty. So there's other ASCs in town, but they're all single specialty. We're the only true in I think probably outside of here to Dallas, or true multi-specialty ambulatory surgery center, which is day surgery center. In Amarillo, in our market area. So
well, that's great. You guys have, I mean, you were able to drastically cut the cost of cash pay bariatrics and keep that where it is. And they do sleeves here. Are they doing switches here?
Yep. So we do duodenal switches, gastric sleeves.
Wow.
So we started doing duodenal switches in August of 2018. So about close to a year after we opened, a little less than a year. And now, our sleeve patients go home on average 2 hours, 17 minutes to be precise after surgery. And duodenal switches go home a little over 3 hours after their surgery. And all the patients, have done great so far. So, I think it's just a testament to physicians and the staff and the recovery staff really setting that expectation up front with the patients about, hey, we're going to get you up and walking, we're going to move you around, and you can go home the same day. So I think patient education, patient expectations, and really setting all those up front really helps.
Absolutely.
That be something that you can do and send them home the same day.
Do they do links here?
We do the
Wow.
link surgery. Yeah.
Cash pay links?
So we've done a couple cash pay links,
Okay.
but mainly, paraesophageal hernia with the links repair is covered by some of the major insurances. So we do those here.
Okay.
So.
Well, man, you guys, we've seen all the patient stories that have come in of people saying how grateful they were because they got quoted a certain price at the hospital and they just couldn't afford it, and they get even superior level of care here. You've got like 100 5-star Google reviews.
Yeah, 176, I think.
Yeah, okay,
Yeah.
sorry, 200 5-star Google reviews. So it seems like the market is appreciating it. Yeah, I think the last question I would end on is, what's the hardest part about running an ASC?
I think it's just because that's a difficult conversation because it kind of changes, So as we're newer, I think it's different when you're in the growth startup phase. The most difficult thing was being patient, continuing to go to insurance companies, and then now it's just okay. We have the day-to-day stuff down. We do the same procedures pretty much consistently. It's just how do we fine-tune? So before it was, hey, let's do any really case we can get, let's do. And now we're at a point was, how do we fine-tune? How do we make it more efficient? How do we get more efficient with time back in the OR? How do we get more efficient with the supplies we're using? How do we get more efficient staffing, So now it's kind of just really fine-tuning and getting everything kind of ironed out. So it's really, we always say, well, let's sharpen that stick, get that stick sharper, every day. So I'm just trying to improve on the processes. And then just day-to-day management, it's always, it has its challenges, but it's been a lot of fun.
I can only imagine. Yeah, and also I want to throw out there, I think because of what you guys learned through this whole process, you guys now do a fair bit of consulting for hospitals and other ASCs around. Is that
correct?
accurate?
So kind of with this, we had hired a consulting company to kind of help us get up and running, and some of the struggles and frustrations with that led us to think like, hey, if we were to go through this again, what were things that we would want to really help walk us through this process and the lessons we've learned? I mean, there's been a ton. So we kind of set up our own consulting company, and we've had hospitals, other ambulatory surgery centers come here and do a site visit, see what we do for pre-op, recovery, back in the OR, how we, are able to send patients home, same day. And we started doing, like, for example, we started doing outpatient total knees. At the beginning, the patient stayed 8 to 12 hours. Every once in a while that happens now, but now the patients are going home a couple hours after surgery and, doing well. So we've had a lot of places reach out and just want to come and kind of see what we're doing, and also ask, how did you get these, on your insurance contracts? And, what were your steps from when you finished construction until you got on commercial insurances? What are all the steps that you need? So we've helped kind of, guide and coach some other facilities through that whole process as well. So, yeah.
Cool. Okay. Well, yeah, and if anybody has questions about that, just, hit reply, or I'll share Mike's contact info too. I think that's good, and we're about 20 minutes in, so I'm going to wrap it up. I'll hit the stop button, and we'll close it up.
Awesome. Well, thank you so much for having me, Maddie. I appreciate it.
Thanks, Mike.